Good morning, students.
Good
Good
morning,
morning.
ma'am.
Okay.
Good
Good
morning,
morning,
ma'am.
ma'am.
Okay. So yesterday you learned about that mediastinum, that is the space between the two pleural cavities and what are its division and what are the contents. Now the heart is situated in which mediastinum? Do you know? Heart is situated in which mediastinum?
Middle.
Middle mediastinum. Good.
Medial mediastinum.
Yes, yes, yes. So middle mediastinum, the heart is situated, and the heart is connected to the great vessels. So they are also situated in the middle mediastinum. Okay. So what are the great vessels? You can see there in the middle mediastinum. What are the great vessels? You will see in the middle mediastinum because they are connected to the heart. What vessels are connected to the heart?
Aorta and pulmonary trunk.
Yes, aorta and pulmonary trunk. Any veins? Any veins are connected to that? Connected to the heart? Any veins who brings the deoxygenated blood to the heart?
Vena Cava.
Vena cava. So there are two vena cava. One is superiorly bringing the deoxygenated blood from the head and neck and also from the upper limb, and the inferior vena cava which is bringing the deoxygenated blood from the lower limb and from the abdomen. So all this area they are drained by the two vena cava, that is superior and inferior vena cava. And the thoracic duct. Do you know what is thoracic duct? What is thoracic duct? Have you heard this name, that thoracic duct? It is present in the thorax, that's why it is known as thoracic duct. But what is it? Is it a blood vessel?
Lymphatic duct.
It is a lymphatic duct. Okay. So it is a largest lymphatic duct in our body. Where it is situated? In the mediastinum, in the posterior mediastinum. Okay. In the posterior mediastinum. So there are many structures are situated in the posterior mediastinum. So they are also situated, that thoracic duct is also situated in the posterior mediastinum, where the roots of the great vessels, they are situated mainly in the superior mediastinum, not in the middle. Middle mediastinum is occupied by the heart and the roots of the great vessels, but that great vessels are also situated in the superior mediastinum. The roots are situated in the middle mediastinum, but their body is situated in the superior mediastinum. And the thoracic aorta is also passing through the posterior mediastinum. So posterior mediastinum, there is the thoracic, descending thoracic aorta and the thoracic duct, and also other structure like esophagus, esophagus vein, sympathetic trunk, many other structures are present in the posterior mediastinum. Okay, so what are the great vessels? The great vessels, though you have told, that is the aorta, the pulmonary trunk, the superior vena cava, inferior vena cava, and also the pulmonary veins. The pulmonary veins, though they are not very larger in size, but they are larger than the other veins. The other veins, that is the veins which are present in our body. So from them, these pulmonary veins are larger than them. Okay, so that is, these are the great vessels. Now the superior vena cava, it is formed by the two brachiocephalic vein. They can also be considered as a great vessels. Okay, the other great vessels which are present, they are present in the neck also. That is the common carotid artery, all these things. Okay. Now today, first we will come to the aorta. Aorta. Okay. The aorta, it is a very big vessel. It is the largest vessel, artery in our body, and it has got many parts. It has a thoracic part and it has an abdominal part. So it starts from the heart. From which chamber of the heart? From the left ventricle of the heart. In the left ventricle there are two parts. One is the rough part, there where the trabeculae carni are present, and one is the smooth part, that is known as aortic vestibule. Aortic vestibule, and the aorta is taken origin from the aortic vestibule, and the opening between the aorta and the heart that is guarded by a semilunar valve that is known as the aortic valve. And after that, this aorta, it ascends upwards. It ascends upwards, so that's why it is known as ascending aorta. And it comes to the that part is situated in the ascending aorta is situated in the middle mediastinum. It it goes up to the sternal angle. Sternal angle, you know, that is also known as angle of Lewis. That is at the level of the fourth and the fifth thoracic vertebra. So up to the sternal angle it will reach, and then it will bend backwards. It will bend backwards and and also towards the left, and it forms an arch and again comes on the posterior aspect at the level of the T4 and T5, at the level of the intervertebral disc between T4 and T5. That is known as the arch of the aorta. From the sternal angle it descends, that is known as the descending thoracic aorta, and then it passes through the diaphragm at the level of the 12th thoracic vertebra and becomes continuous in the abdomen on the left side of the vertebral column, body of the vertebral column, and that is the abdominal vertebra, this abdominal aorta. Then at the level of the L4 it divides into two common iliac artery, and throughout its course it gives many branches. It gives many branches. Now what is ascending aorta? Now ascending aorta, you can see it is coming from the aortic vestibule, that is the smooth part of the left ventricle, and then it ascends towards the sternal angle. And as it ascends, it passes behind the pulmonary trunk, which is coming out from the right ventricle. That is then also an artery, that is the pulmonary trunk. Then it passes behind it, but as it crosses, it comes to its right side and also slightly anterior to the pulmonary trunk. Then it crosses the right pulmonary trunk. It runs anterior to the right pulmonary trunk. Okay, so there is a twist. There is a twist. Initially it was behind, then it comes to its right side and to the front and reaches up to the sternal angle, and then the arch of the aorta starts. Now this ascending aorta, where it starts, it has got three semilunar valves, and these valves are known as the cusp and the aortic cusp, and between the aortic wall and the aortic cusp there is a dilatation. These dilatations are known as aortic sinus. Now there is one, these are the aortic sinus. This is the anterior aortic sinus, and there are two posterior aortic sinus. One is on the right side, another is on the left side. And from this sinus, the coronary arteries will arise. So there are two coronary arteries. One is the right coronary artery and another is the left coronary artery. Now the right coronary artery, it takes origin from the anterior aortic sinus. And the left coronary artery, it takes origin from the left posterior aortic sinus. And the right posterior aortic sinus doesn't give origin to any coronary artery. So therefore this area is this sinus may known as non-coronary sinus. Then the body of the aortic arch, ascending aorta, extends up to the sternal angle. Up to the sternal angle. Then it forms the arch of the aorta, which goes posteriorly and to the left and reaches at the level of the third and fourth and fifth intervertebral disc. Okay, the intervertebral disc between the fourth thoracic vertebra and the fifth thoracic vertebra. Okay, now here you see this is arch of aorta. So here I have not kept that one. The cusp I have not kept. Okay. So that that picture is not here. That is the sinus. It is between the cusp, the semilunar cusp, and the wall of the aorta. These are known as the aortic sinus. So these three aortic sinuses are present. Now here you come to the arch of the aorta. Then the arch of the aorta that starts in the sternal angle on the right side and comes again to the sternal angle on the left side. But in this region, it not passes through the same plane, it goes to the posterior and to the left towards the vertebral column. And in this region, it gives, in the arch, it gives three large branches. On the right side, it gives the brachiocephalic trunk, then it will give the left common carotid artery, and then the left subclavian artery. So this is the brachiocephalic trunk, left common carotid artery, and the left subclavian artery. Here also you can see that is the brachiocephalic trunk, left common carotid artery, and the left subclavian artery. Now, then this aortic arch, it goes to the posterior side between at the level of the intervertebral disc between T4 and the T5. Now, in this level, you can see it is connected to the left pulmonary artery or to the pulmonary trunk by a ligament, and that ligament is known as the ligamentum arteriosum. It is the remnant of the ductus arteriosus. Ductus arteriosus. Now, the area between the subclavian artery and the ductus arteriosus, that area is known as the aortic sinus. After this sternal angle, it is continuous as descending thoracic aorta. Okay. Now, what are the relations of the aortic arch? It is very important. Okay. So, it is going from the front to back, from the right to left. So, it has two relations. One is the anterior and to the left. This is the left side and this is right side. So, this is anterior and to the left. Also, it is related posterior and to the right. Also, there are relations above the aortic arch and relations below the aortic arch. So, what are the relations anterior and to the left? Here you can see one large nerve is going down, that is the left vagus nerve, and the left phrenic nerve is also running. So, they are in front of them. Also, there will be the cardiac branches. The cardiac branches coming from the sympathetic trunk, that is they form the superficial cardiac plexus, that is the superior cervical cardiac branch of the left sympathetic and also the inferior cervical cardiac branch of the left vagus. One vein is going to drain into the brachiocephalic vein, that is the left brachiocephalic vein, this one. So, that is known as the superior intercostal vein. So, that is also present here. So, here anteriorly and to the left you will get the lung and pleura, because the aortic arch, you know that it forms an impression. It is very close to the left lung. So, left lung and pleura, it forms an impression over the hilum of the left lung. So, anteriorly and to the left, it is related to the left lung and pleura. And also you can see the left phrenic nerve and the left vagus nerve is there, and that is inferior cervical cardiac branch and the superior cervical cardiac branch. Another vein will come and it will drain into the left brachiocephalic vein, that is the superior intercostal vein. Now, posteriorly and to the right, you can see that is the trachea is there, and behind the trachea will be esophagus, and behind that is the vertebral column. So, all these structures, they are related to its right side as well as to its posterior aspect. Also, here you can see one branch is given from the vagus nerve, that is the left recurrent laryngeal nerve, which runs in front of the arch of the aorta, but again it hooks round the arch of the aorta. So, it comes to under the arch of the aorta and then go to its posterior aspect and run in the groove between the trachea and the esophagus. So, the left recurrent laryngeal nerve between the trachea and the esophagus, you will get the left recurrent laryngeal nerve. Also, the deep cardiac plexus is also present posteriorly, and the thoracic duct, the esophagus along with the thoracic duct. So, trachea esophagus. In between them, there will be the left recurrent laryngeal nerve, and the thoracic duct is also there, and also there will be the deep cardiac plexus. So these are the posterior relation. So what are the superior relation? The superior relations, there are three arteries, its own branches, and they are crossed by the left brachiocephalic vein. They are crossed by the left brachiocephalic vein. So these are the superior relation. Inferior relation, what is that? That is the trachea is dividing into the two bronchus, and the pulmonary trunk is dividing into right and left pulmonary artery. The left recurrent laryngeal nerve also below it, and also it is connected. That is the ligamentum arteriosum is there. That is the remnant of the ductus arteriosus. So these are the aortic arch. Here you can see the superior intercostal vein, which is crossing the in front of the aorta, and it is draining into the left brachiocephalic vein. So its superior relation is the own branches, the left brachiocephalic vein which crosses all the branches, and sometimes the thymus, it comes very close, it runs comes into the superior mediastinum, and it may run in front of them, but usually normally it is present above the aortic arch, so superiorly the thymus may also be related to it, and inferiorly you can see here the bifurcation of the pulmonary trunk, the ligamentum arteriosum is there, the bifurcation of the bronchus, and it comes in front of the behind the left bronchus, so that is the left principal bronchus will also be there, and the left recurrent laryngeal nerve, the superficial cardiac plexus that is in front of the bifurcation of the trachea, and the thoracic duct I have written, but that is posteriorly, it is mostly related to its posterior aspect. Now the descending thoracic aorta. Now descending thoracic aorta, from the sternal angle it will start, from the sternal angle, here the sternal angle, so from the sternal angle it will start, and it descends down in front of the thoracic vertebra, and then it pierces the diaphragm at the level of the 12th thoracic vertebra, and runs in front of the lumbar vertebra in the abdominal aorta. Now in the thoracic part, it gives many branches. So what are these branches? So this is the third intercostal artery, third posterior intercostal artery, fourth, fifth, sixth, seventh, eighth, ninth, 10th, 11th. So third to 11th intercostal, posterior intercostal artery. They are not only present on one side, they are present on both sides. They have shown here on one side, but they are present on both sides. So there are left posterior intercostal artery as well as right posterior intercostal artery. All are the branches of the descending thoracic aorta. So the first and second intercostal artery, that they will take origin from another artery that is known as the costocervical trunk, which is a branch of the left subclavian artery. So left subclavian artery gives a branch that is known as the costocervical trunk, and from there the first and the second posterior intercostal artery will arise. So from the third to 11th posterior intercostal artery. What about the 12th? The 12th, it passes, it comes to the abdomen. It originates in the thorax, but from the descending thoracic aorta, but it comes to the abdomen and it passes through an opening in the diaphragm. So that is known as the subcostal artery. The 12th posterior intercostal artery is also known as the subcostal artery because it is below the 12th rib. So it is known as the subcostal artery. and these posterior intercostal artery, they are present in the intercostal space, but the subcostal artery, it doesn't present in the intercostal space, it is present below the 12th rib and it comes to the abdomen. So that is the subcostal artery. So these are the posterior intercostal arteries in pairs. And also towards the mediastinum, it will give some branches, that is the mediastinal branches. It will give the branches to the pericardium, so pericardial branches. It will give branches to the bronchus, so bronchial branches. The esophagus is very close to it, so it gives also some esophageal branches. So these are the branches. Ultimately, lastly it will give the branch to the superior part of the diaphragm, that is known as the superior phrenic artery. Superior phrenic artery. So there are many branches. So from the arch of the aorta, from the ascending aorta, there are two branches. One is the right coronary artery, one is the left coronary artery. The right coronary artery arises from the anterior aortic sinus and the left coronary artery arises from the left posterior aortic sinus. There is another aortic sinus, that is right posterior aortic sinus, which does not give any branch, and that's why it may be known as the non-coronary sinus. There is coronary sinus, you know, that is the veins draining the heart, that is the coronary sinus, and the non-coronary sinus is actually the right posterior aortic sinus, because it does not give rise to any coronary artery. Then the aorta, arch of the aorta, it gives three branches mainly. Sometimes it gives a branch from its internal aspect, from its inner aspect. So that is known as the arteria thyroidea ima. Sometimes it is present, it is not always present. But this three trunk, that is the brachiocephalic trunk, which ultimately divides into right common carotid and the right subclavian artery, and then it gives the left common carotid artery. The right common carotid and the left common carotid, they will ascend upwards into the neck by the side of the trachea, and the left subclavian artery that will come to the upper limb and becomes the axillary artery later on, and the brachiocephalic trunk on the right side, that will give the right common carotid and the right subclavian artery. Okay, so these are the branches. Now you come to the descending thoracic aorta relation. So the descending thoracic aorta, it is related anteriorly and also to the posteriorly. Anteriorly and posteriorly. Also there are some relation on its lateral side also, right and left. Okay, so this is the left side. We are seeing that picture from the left side. Now anterior relation, what are the structure? Here you can see that is the bronchus and the pulmonary veins are also present, and this is the hilum. Okay, and the pulmonary arteries, bronchus, these are present. Pulmonary veins are also present. So that is the hilum of the left lung. So it is related in front. There is the hilum of the left lung. You know that the descending thoracic aorta, it forms an impression on the left lung just behind the hilum, isn't it? So here you can see the hilum. And what is this part? This is the left atrium and it is covered by the pericardium. So they are related anterior aspect. There is another vessels can be seen, that is the esophagus. Esophagus, it runs on its right side. You cannot see because we are seeing from the left side. So esophagus, it runs on the right side. Then it crosses the aorta and comes in front of it. It comes to the left side and in front of the descending thoracic aorta. And also this is the left dome of the diaphragm. It passes behind the diaphragm and then it passes through the diaphragm at the level of the 12th thoracic vertebra. So these are the hilum of the lung. What is this? That is the atrium of the heart, and then the esophagus and the diaphragm. So anteriorly it is related to the hilum of the left lung, the left atrium, the lower part of the esophagus here and the diaphragm. Posteriorly, it is related to the vertebral column, and also on the left side there will be the hemiazygous vein and the accessory hemiazygous vein. So vertebral column, the hemiazygous vein and the accessory hemiazygous vein. On the right side, it is related to the esophagus. Along with the esophagus, there will be the thoracic duct and the azygous vein. Left side, there will be the hemiazygous vein. On the right side, there will be the azygous vein. And it is also related to the right lung and pleura, but it doesn't give any impression to the right lung and pleura because it is more towards the left side. And to the left side, the left lung and pleura, it is very close to the left lung and pleura. So that is the relations of the descending thoracic aorta. Okay. Now you come to the some clinical, one clinical picture I have kept, that is the aortic dissection. What is aortic dissection? Now it is a very serious condition. If it happens, usually it is the rare condition and very serious condition, and it occurs in the old age. Now if the intima, there is any gap in the intima, then blood will enter through that gap and it comes between the intima and the media. That is known as the dissection. It may occur anywhere. It may occur anywhere. But when it occurs, it is a very serious condition that I have told you already. And there will be pain. That is something is tearing. Like that type of pain will occur. It may occur in the chest. It may occur in the abdomen. Okay. So that is the aortic dissection. The treatment sometimes that is a very that is in the cardiothoracic department they will do it. That is the graft. They will place one graft in that region. So that is aortic dissection. Now you will come to the pulmonary trunk. Now the pulmonary trunk, like this left, that one, the aorta, it takes origin from the aorta, by left ventricle, and the pulmonary trunk, it takes origin from the smooth part of the right ventricle. The smooth part of the right ventricle is known as the infundibulum. The smooth part of the right ventricle is known as the infundibulum. These are the cusp. There are also the sinus, pulmonary sinuses are present, like the aortic sinuses are present. So pulmonary sinuses are present. There are 3 pulmonary sinuses are present. 1 posterior and 2 anterior pulmonary sinuses are present. But no veins, no artery will take origin from these sinuses. And these sinuses are smaller than that of the aortic sinuses. Now this pulmonary trunk, after its origin, it ascends up to the and goes towards the left side, and it divides at the level of the sternal angle into 2 arteries. That is the right pulmonary artery and the left pulmonary artery. Now why they have made it blue color? Because it carries deoxygenated blood. The deoxygenated blood comes from the right atrium to the right ventricle, and then that deoxygenated blood is passing through the lung, to the through this pulmonary artery. So this artery, though they are known as artery, but they are taking the deoxygenated blood. Okay. So this is the left pulmonary artery and this is right pulmonary artery. Right pulmonary artery runs behind the arch of the aorta, or runs behind the ascending aorta and also behind the superior vena cava. And this right pulmonary artery, before entering into the hilum, it will divide, and in the right side there are 3 lobes of the right lung. So it will give the branches to each lobe of the lung. Similarly, the left pulmonary artery goes towards in front of the left bronchus, and the right pulmonary artery also runs in front of the right bronchus, and the left pulmonary artery runs in front of the left bronchus, and it also first it divides into 2 branches to supply the upper lobe and the lower lobe of the left lung. Okay, and this left pulmonary artery or the pulmonary trunk, they are connected in the fetal life by the ductus arteriosus. So during fetal life, the right pulmonary artery and the left pulmonary artery, they receive the they pass to the lung, but their main blood passing to the aorta through the ductus arteriosus, So after birth, when the when the baby born, then when he takes breath, then when the lung starts to function, then that function of the ductus arteriosus, it is not there, and then it becomes obliterated and form the ligamentum arteriosum. Okay, so that is the right and the pulmonary trunk, which is dividing into the right and the left pulmonary artery. Okay, so here you can see that right and left pulmonary artery, this is the ligamentum arteriosum. Okay, now here the this is pulmonary arteries. When they enter, they will supply in the right side, there will be lobar arteries, that is for the upper lobe, for the lower lobe, and the lower lobe will supply to the middle lobe as well as to the lower lobe. So they are dividing into 3 lobar arteries for the right lung. In the left lung, they will divide into 2 lobar artery, one for the upper lobe, one for the lower lobe. And for the lower lobe, they will supply the lingula also. Then this lobar artery, then they divide into segmental artery. There are 10 bronchopulmonary segment. So they will enter into the bronchopulmonary segment. So that is known as the segmental artery. Inside the bronchopulmonary segment, they will divide into the intersegmental artery, then the lobular arteries. Ultimately, they will form the capillaries, and that not capillaries, that is the venules. The pulmonary artery divides into, ultimately they will divide into capillaries. Okay, and then the pulmonary vein will start. So pulmonary vein, that is the pulmonary venule, they carry, there will be the gaseous exchange between the capillaries and the alveoli. There will be gaseous exchange. Now the oxygen will come to the blood and the venules will start. These venules will form the segmental veins, then they will form the intersegmental veins, then they will form the segmental veins. Ultimately, the segmental veins, they will join to form the lobar vein, and they will form the, ultimately on the right side, the 2 pulmonary veins will be formed, that is known as the right pulmonary veins. These are the pulmonary veins. These are the, they are carrying oxygenated blood. So pulmonary veins will be formed. 2 pulmonary veins from the right side and 2 pulmonary veins from the left side. And where they will drain? They will drain into the left atrium. So 2 pulmonary veins from the right side and 2 pulmonary veins from the left side, they will drain separately into the left atrium. Sometimes there may be 3 pulmonary veins due to developmental defect. Sometimes there may be 5 pulmonary veins also may be present. So what is that pulmonary circulation? The pulmonary circulation, that is the circulation of blood from the heart and between the heart and the lung. So heart receives deoxygenated blood in the right atrium through the superior vena cava and the inferior vena cava, and that deoxygenated blood enters into the right ventricle, and then it passes through the pulmonary trunk and then through the pulmonary artery into the lung, and where it divides into lobar artery, segmental artery, intersegmental artery, lobular artery, ultimately capillaries, and there will be exchange of gaseous exchange will be there. Ultimately the veins will be formed, the same name veins will be formed, and these pulmonary veins, ultimately they drain into the left atrium, go to the left ventricle, and then again the systemic circulation will start. Okay, so that is the pulmonary circulation. So here I have already shown you the pulmonary circulation. Superior vena cava, inferior vena cava, right atrium, right ventricle, pulmonary trunk. Then through the pulmonary artery it will go to the lung, oxygenated pulmonary vein, and pulmonary vein will drain into the left atrium. Okay. And then to the left ventricle. So that is the pulmonary circulation. So there will be the lobar arteries, then there will be the segmental artery, then subsegmental artery, then intralobular arteries. Similarly, the interlobular veins, when it will start, then that will form the subsegmental vein, the segmental vein, ultimately the lobar veins will be formed, and then these lobar veins, they join together to form the pulmonary veins. Okay. Now come to the veins. So the large veins. So one is the superior vena cava, another is the inferior vena cava. Superior vena cava, you can see that superior vena cava, it carries the deoxygenated blood, and it is draining into the right atrium at the level of the third costal cartilage, or third intercostal space, or third costal cartilage. Now they are formed by the junction or joining of two brachiocephalic vein. One is the right brachiocephalic vein, another is the left brachiocephalic vein, and these two veins join behind the first costal cartilage. Behind the first costal cartilage, they will join together to form the superior vena cava. Then the superior vena cava pass behind the first intercostal space, second intercostal space, and then at the level of the third costal cartilage, they enter into the right atrium. The superior vena cava, it is a very big vein, and its diameter is very big, but it has no valve. The veins, they have valves, but the superior vena cava has no valve. And the superior vena cava, its wall is very thin. So it is very easily compressed, particularly if there is any enlarged lymph node that may compress, or if there is any tumor, lung cancer is there, there will be enlarged lymph node again, and that may compress, or it is very close to the thyroid gland. Sometimes the thyroid gland is very big. In case the enlargement of thyroid gland is known as goiter. So in goiter, if there is a large goiter, that can compress the superior vena cava, and when it is compressed, then it drains the blood from our head and neck, and also from the superior extremity. So if it is obstructed, then those veins cannot drain into the superior vena cava, and they will be engorged, and there will be edema. I am coming to that. Now first you come to what are the tributaries of the superior vena cava. The superior vena cava, it is present in the superior mediastinum. So it receives the mediastinal vein, the esophageal vein, the cardiac vein, pericardial vein. Also its two large tributaries are these, right brachiocephalic, left brachiocephalic. Another important vein is draining into the superior vena cava, that is the azygous vein. Azygous vein drains into the superior vena cava. So what are the tributaries? The right brachiocephalic and that left brachiocephalic, they are the formative tributaries. Another important tributary is the azygous vein, and also there will be the other veins like mediastinal vein, esophageal vein, pericardial vein. So these are the tributaries of the superior vena cava. And I have told the obstruction. In case of obstruction, particularly in case of goiter or lung carcinoma or in any enlargement of lymph node, so there will be swelling, the veins will be engorged in the upper limb, in the right side of the thorax, and also of the head and neck region. And there will be cyanosis, in that edema will be present because of this venous engorgement. The edema will be present, and the collateral veins will also appear, collateral veins, so that you can see that the engorgement of the blood vessels in the upper limb, in the chest, on the right side particularly, and also in the neck region, head and neck region. Okay, and there is a test to see whether the superior vena cava is obstructed or not. If you ask the patient in case of goiter or in case of lung carcinoma where there is an enlarged lymph node, if you ask the patient to elevate his arm, then the obstruction will be more, and in that case there will be edema and also there will be cyanosis. So that is known as the Pemberton's test to see whether there is any obstruction in the venous obstruction is there or not. Now we come to the brachiocephalic vein, that is the right brachiocephalic vein is smaller. It is formed by the union of the right subclavian vein and the right internal jugular vein. The left one also is formed by the left internal jugular vein and the left subclavian vein. They join together to form the left brachiocephalic vein. But the left brachiocephalic vein, it runs towards the left side, crossing all the branches of the arch of the aorta. It comes from the left side to the right side. So it is coming to the right side. From the left side, it is coming to the right side. And at the level of the first costal cartilage, that is just behind the first costal cartilage, the right brachiocephalic vein, which is very short, you can see that the length of the right brachiocephalic vein is half than that of the left brachiocephalic vein, but they meet together. They come vertically. The right brachiocephalic vein runs vertically and the left brachiocephalic vein comes obliquely, and they join together behind the first costal cartilage and forms the superior vena cava. Okay, so that is the right and left. They also don't have any valves. Now the tributaries of the brachiocephalic vein. So tributaries of the brachiocephalic veins are many. One is vertebral vein, which that comes drain the blood from brain and also from the posterior region of our body. Okay, so that is the vertebral vein. The first intercostal vein, sometimes that drain into the brachiocephalic vein. First intercostal vein, sometimes that drain into the brachiocephalic vein. Then the thyroid, from the thyroid, the inferior thyroid vein, they drain into the brachiocephalic vein. Then from the thorax, the internal thoracic vein, that is the internal mammary vein. You know that internal mammary vein, just behind the costal cartilage, that vein is present. That is the inferior internal thoracic vein or internal mammary vein. So these veins, they drain into the brachial vein. And also the superior intercostal vein, that is formed by the second posterior intercostal and third posterior intercostal, they form the superior intercostal vein that drains into the left brachiocephalic vein. So these are the tributaries of the brachiocephalic vein. Okay, now come to the inferior vena cava. It is also a large vessel, but it is present mostly in the abdomen. So we will not discuss its abdominal part, but that it also pierces the diaphragm at the level of the 8th thoracic vertebra in front of the inferior vena cava, and its mediastinal part, that is in the middle mediastinum, it enters. It pierces the diaphragm and enters into the right atrium. So you can't see it. A very small part, it is present in the middle mediastinum. Soon it enters, and as it enters into the right atrium, it is guarded by a valve, that is a semilunar valve, guarded by a valve, and that valve is known as the valve of inferior vena cava or the Eustachian valve. You can see that right atrium, this is the rough part, this is the smooth part, or known as the sinus venarum. Here the superior vena cava is draining in its upper part, inferior vena cava. Superior vena cava has no valve, but the inferior vena cava has valve. That is the Eustachian valve or the valve of the inferior vena cava. So it has some function. So initially the oxygenated blood comes through the inferior vena cava, and that is directed towards the foramen oval to the left atrium. So that direction that was guided by that valve of the inferior vena cava, whereas the superior vena cava, which carries the deoxygenated blood even in fetus, that goes directly downwards. Only there is some mixture, but mostly it will go to the right ventricle. So superior vena cava, deoxygenated blood go directly to the right ventricle in fetus, but the inferior vena cava's blood, which is deoxygenated, which carrying the oxygenated blood from placenta, ultimately it comes through the inferior vena cava, terminal part of inferior vena cava, and is directed through the foramen oval into the left atrium. So left atrium gets mostly the oxygenated blood. By this, that was guided by the valve of the inferior vena cava. This is the coronary sinus opening. Okay, there is also a valve. So that is inferior vena cava is here. Now come to the thoracic duct. Now thoracic duct, it is a largest lymphatic duct in our body, but it is very difficult to see. And it starts from a sac, from the top of a sac. That sac is known as the cisterna chyli, which is present in front of the first lumbar vertebra, that is below the diaphragm. Okay, so from the apex of this sac, this sac receives the intestinal lymph trunk, and that intestinal lymph trunk also receives the lymphatic vessels from the lower limb. So from both the lower limb and also from the abdomen, from the abdominal structure, the lymph will come into the cisterna chyli and it will form a sac. And from that sac, from the upper part of that sac, the thoracic duct will start. And that thoracic duct, it has to enter into the thorax. So through which opening it will enter? It will pass through the aortic opening of the diaphragm, that is on its right side. Okay, so it enters through the aortic opening and it runs in the posterior mediastinum, mostly on the right side, but at the level of the fifth thoracic vertebra it will cross it, and it goes to the left side. So that is the thoracic duct. Here you can see the thoracic duct, though they have not colored it, they have made it white. Okay, so this is the cisterna chyli. It enters through the aortic opening of the thoracic duct and runs mostly on the right side and reaches up to the sternal angle. That is the intervertebral disc between the T4 and T5, and there it crosses from the right side to the left side, and ultimately it enters into the superior mediastinum, and it comes towards the root of the neck, enters into the neck, and then it arches, it bends. Okay, it runs behind the internal jugular vein and drain at the junction of the left internal jugular and the left subclavian vein. Before draining into this vein, into the angle, or either into the left subclavian vein or at the junction of the left internal jugular or left subclavian vein. So before draining here, it receives the trunk from the left side of our head and neck region, that is known as the left jugular trunk. It also receives the another trunk from the left upper limb, that is known as the left subclavian trunk. It also receives another trunk from the left side of the thorax, that is known as the left mediastinal trunk, bronchomediastinal trunk. So it receives not only from the abdomen and from the lower limb, It also receives lymph from the left side of our head and neck region, left side of the upper limb region, and left side of the thorax. So on the right side, these regions will be drained by another small duct that is known as the right lymphatic duct. So 1.25 centimeter long, and it drains at the junction of the right subclavian and the right jugular internal jugular vein, and here also it receives the three trunk, that is the right jugular lymph trunk, right subclavian trunk, and the right bronchomediastinal trunk. Okay, so that is the right lymphatic duct. So tributaries of the thoracic duct, what? That is the cisterna chyli. Cisterna chyli, it receives the intestinal lymph trunk, that is, and the lumbar lymph trunk, that is the draining the lower limb. So lumbar lymph trunk draining the lower limb, intestinal lymph trunk draining the abdomen, and they enter into the cisterna chyli, and then the cisterna chyli starts at the level of the sternal angle. It deviates towards the left side, and then it runs behind the internal jugular vein, forms an arch. It crosses at the root of the neck, and it receives the left jugular lymph trunk, left subclavian lymph trunk, left bronchomediastinal lymph trunk. Right side, there is one small lymphatic duct is present, that is known as the right lymphatic duct. It also receives the right jugular trunk, right subclavian trunk, and the right bronchomediastinal trunk. So these are the thoracic duct. Sometimes this thoracic duct, if it ruptures, sometimes it is very close to the pleura. So in the pleural sac, the chyle, that is the lymph fluid, that is the lymphatic fluid chyle may be accumulated inside the pleural cavity, and that is known as chylothorax. Okay, so that is, I think that is the last slide. Okay, and here another assignment I have given, that is the thoracic part of the aorta. That means you have to write about the ascending aorta, about the arch of the aorta, and the descending thoracic aorta, not about the abdominal aorta. Okay, all these structures, what are their branches and their relations, and also the thoracic duct. Okay, so only two questions I have given. Do you have any question? Do you have any question? No? Okay. Thank you then.
Thank you, ma'am.
Thank you, ma'am.
Thank you.